All right, I'm here with Dr. Bedai. Dr. Bedai from Pittsburgh and a dentist. Hi, Dr. Bedai.
Helmut, how are you?
Good. Dr. Bedai, let me ask you a question here, which some of us patients, really are wondering about. Some of us have teeth missing, 1, 2, or 3 in the back of their mouth, and frankly, they're missing for a while, half a decade. And nothing really bad has happened. And yet, dentists like you keep telling us you gotta fix them, you gotta replace them, you gotta keep them, otherwise all hell breaks loose. And yet, all hell hasn't broken loose in the last 4, 5, 6, 7, and more years. Shed some light on it.
Well, some hell maybe has broken loose, and a lot of times, Helmut, the patients aren't aware of that. Get the idea that if you have, a clock with some gears in it, okay, you may have some teeth missing. Maybe the clock will work sort of good, maybe it won't, but when things start falling apart, then people can't chew correctly. They can't, there's a lot of stress and strain on their muscles. There's a multitude of things that happen that are bad that happen gradiently, so the patients half the time are really unaware of what's going on. They feel that they can chew and do things comfortably in there, and if you really sit down and ask them, they've sacrificed some things. So it's a domino effect. With teeth missing, things start breaking down.
Tell me which of the things which are breaking down. Give me some very specific, starting with the maybe whatever, and give us the whole spectrum.
Okay, so good. So as soon as teeth are missing, one of the first things that will happen is that the jawbone starts to disintegrate. It basically dissolves away. The teeth hold the jaw in place, and the jaw holds the teeth in place. So get the idea that once a tooth is taken out, that jaw can become just amazingly thin. I've seen it as thin as a pencil on patients who have lost all of their lower teeth. And it happens if you lose a few teeth in the back. So one thing that will happen is the jawbone will shrink.
And what does that mean? Is that when you start having caved-in faces and you start looking like a dried-out tomato?
Absolutely, absolutely. I don't think too many people want to look like a dried-up tomato. So get the idea that the function of the face, all of the teeth in place, and that jawbone in place will keep the youthfulness of the patient's appearance in there. Not only will it help you chew, but it fills it out, and it allows the just to look more youthful instead of all caved in. If you've ever seen anybody with dentures, Helmut, and a lot of people have, they take their dentures out, and their face and their muscles are just all caved in. So by removing some teeth, or losing some teeth, I should say, you can add 10, 15, 20 years to your age and appearance within 6 months after losing some teeth.
So basically keeping your teeth, whatever needs to be done to do that, and or putting them in where a dentist like you seems to be like rejuvenating, seems to be the best plastic surgery one can possibly do.
It certainly is. I mean, it will keep the youthfulness and the appearance of the face in there, and you can think of it in terms of plastic surgery. That's a great way to put it. But yeah, you're right. It will help the youthfulness and basically the cosmetics, the wrinkles all along, the sagging. It just keeps that from occurring at more of a faster rate than just life allows itself.
Wonderful, because that's really great. Now, another thing. You mentioned, the chewing, and that's what most dentists and most people have say that, your chewing is one-sided. And me being a mechanical machinery engineer, kind of like, I look at it like a door with hinges. So if you chew one-sided, again, you might be getting a little, crooked looking. But tell me something about, like, tensions in the neck, headaches and stuff. Is it really possible that stuff comes from missing teeth?
Oh, 100%, absolutely. The stress that is put on the muscles of the mouth, and it's extremely, the muscles that chew are extremely powerful. So there's a lot of stress put on the jaw, and get the idea that all of these muscles connect towards the back of the neck. It can cause an extreme amount of jaw pain, headaches, stiff neck, and that can go down even into the when you're in the back of the cervicals in here on the neck, that can go down into the shoulders and even cause some numbness in there, in the shoulders and in the hands. So it's all connected. By keeping that in balance, just the same way that people stretch, they keep everything in balance with, let's say, maybe yoga, stretching, that sort of thing. Or they're fans of chiropractic because they want to keep things in alignment. Keeping the teeth in place will also help keep all of the jaws and everything in alignment. So very, very important, and a good point that you brought up in there. You know, it's just not in chewing, it throws everything out of balance.
Yeah, and I think that needs to be obviously pointed out, and we need to realize that, because so what you're saying is here that if a person has headaches and constantly is all tight around, he might, and he has tried all kinds of things and it doesn't get quite away, and or comes back, visiting a dentist and telling a dentist about those symptoms might be a good thing to do, because he might check in and might find things which create that.
It would be an excellent thing to do. I mean, one of the first precursors or things that people will have is waking up in the morning with a lot of tension in their jaw or some headaches. That's one of the primary things that happen, and we know a lot of people have headaches. I mean, that seems to be sort of ubiquitous on the planet. You know, it's there for just about everybody. So get the idea that a lot of the stress by having missing teeth in the back and in the jaws cause these problems that seem to be everyday problems, but a lot of times are well alleviated by just good balancing of the dentition, putting some teeth back, and getting people just a good solid bite back in there so that everything is balanced.
Wonderful. I definitely like the part about looking better and shaving off a few years of your age. I mean, whether we are guys or girls, I think in the end we all try to look a little bit our best. It's just good to look good, right?
Absolutely. Who doesn't want to look better? I mean, everybody today is very much impressed, and we see it all over the news media. Cosmetics, look young, look good. I like to look good. You know, I'm sure you do too. So it just helps. It helps in the patient's appearance. And once again, you know, we're talking, maybe emphasizing in your helmet, that we're not necessarily just talking about those few front teeth that you can see. Yeah, I mean, people like to have those look good, but this is in the back. These are in areas that will cave things in, that will cause aging and sagging in there, just as important as those front teeth being nice and pearly white and shiny. You brought up a great point.
Well, Dr. Bettis, thanks for letting us know about that. I'll have more conversation with you about more topics on dentistry. Bye-bye for now.
Okay. Nice talking to you, Helmut. Have a great one.
Same here.